An animated film about a young woman who fights coronavirus misinformation is out today. Priya's Mask sees Indian comic book superhero Priya confront fake news around the pandemic and highlight steps people can take to reduce the risk of infection. In India, particularly, unverified claims around the benefits of drinking warm water, herbal remedies, and spices as a means to ward off the coronavirus have spread rapidly on social media. The animated film, in addition to a comic book, challenges these claims and does more. Here's a small peek.
I wish we could go back in time, Ma. We used to go to the park together and play. But now I barely see you.
Don't be afraid. I am Priya, your friend, and this is Sahas.
Why are you sad, Meena?
I miss my friends. I have no one to tell my feelings to.
Come on, let's go on a journey. Have you ever been on a flying tiger? Sometimes we have to be strong, so those who love us can also be strong.
That's my friend Leena's kite.
Let's say hi to your friend.
Hi. That's my Ma. She works as a nurse here.
Your ma has sacrificed her time with you to take care of those who need help because of the virus. I am sure she misses you too, Meena. But right now, she is the hope these patients need.
Priya, we need to stand together and bring about the change we want to see.
That's how we can beat the virus.
Continue to wear a mask for your safety and mine.
Joining me now, well-known Hindi film actress Mrunal Thakur, the voice of the main character Priya. That's the young woman on the flying tiger. Mrunal, thank you so much for making the time. Now, the cartoon itself is called Priya's Mask. Is the message mainly about wearing a mask during this pandemic, or is there something more?
Yes, of course, it's about the pandemic. It's about wearing a mask, and it's about keeping ourselves and the loved ones safe. There's this beautiful line in the animated film that you would see that is sometimes we have to be strong in order that, people around us, people who love us can be strong. This time is so difficult, especially because of the COVID-19 situation. We have lost our loved ones. We have to be inside, locked up in our house, not being able to meet our friends and family. So Priya's Mask is all about COVID-19. It's about educating the children because there's so much fear, there's so much anxiety, the fear of, the fact that they can't meet friends, they have to virtually attend their schools. So it's a beautiful one where, we're just trying to make sure that the kids understand what COVID-19 is all about, how this pandemic has affected us, and how their parents are their superheroes. So Priya's Mask is all about it.
Right. And you, like everyone else, have also naturally experienced this pandemic. I wonder if that experience helped with voicing Priya?
Yes, absolutely. Trust me, the beginning of this lockdown was extremely gloomy and very depressing for me. But my father, who's a government employee, I've seen him working all throughout this pandemic. And I realized that he is my superhero because he's making sure he's stepping out of the house. He's serving the nation. He's a banker. And after voicing this character, when I reached home, I asked my father if he was doing okay. And when I told him that you are my superhero, he had that twinkle in his eyes. He almost had tears. And it is very important for our parents to know from their daughter or their son that, they are their superheroes and they did make a huge difference in their lives.
Right.
When I was voicing this character, I was really excited and I was nervous because this is something that I've never done before. And I always wanted to have this kind of character who, so Priya's strength is her power of persuasion. And that's what I resonate with me.
Speaking of persuasion and people who worked through the pandemic, people such as your father, do you think that these people who have been able to carry on with their jobs or have had to carry on with their jobs, such as bankers and doctors, through this pandemic, have got their fair share of recognition, or have they unduly had to face problems while they've been working?
Yes, they did not get their share of, that's why probably this is the reason why we made this film, so that we we appreciate the frontline workers, the doctors, the nurses, uh, and just to let them know that they did make a huge difference. And if they weren't around us, I don't know what we would have done. So they did not get their credit. So this is little something that from my team, from Priyas Mask, the entire team, we just wanted to appreciate, for the fact that they've worked so hard throughout this pandemic. So just want to say through your interview, just want to say thank you to each and every pilot who has left the people from various countries and got back to their homes, and or thank you to all the doctors who have treated COVID-19 patients.
Right.
And trust me, this thank you is not enough.
What would you say to those people who are hesitant, or rather who won't follow the rules, such as wearing masks or keeping social distance? I mean, you see this in India all the time. What would you say to those people?
Yeah. I think we just need to be responsible citizen. If you like people of whoever I meet on the streets, if they're not wearing a mask, or all I do is I just go and I request them, if you could just please wear a mask. You may not. Your immunity may be strong, but you may have that asymptomatic, you may be asymptomatic, but if you take the virus home, it may affect your mom, it may affect elderly people, it may affect people who have underlying diseases. So please, please, not for your sake, just for your sake, but for the sake of your family and for the people who are already suffering through other health issues, please, for them, wear a mask, take precautions.
Ronald Thakur, hoping that they take your advice. Pleasure talking to you. Thank you so much.
Thank you so much.
India has recorded more than 9 million cases so far and is the second worst affected country globally. But what is also driving up numbers is the spread of unverified claims to do with the transmission of the virus and how to stop it. Pratik Sinha is co-founder of Alt News, a fact-checking website in India. I began by asking him what kind of misinformation he had seen spreading on social media in the country.
It's mostly been health related of late. There have been different strains of misinformation vis-a-vis coronavirus. There was a time in between when the pandemic was communalized and the Muslim community in India was targeted using false videos and images, trying to suggest that they are willingly spreading the pandemic. This was in the month of April, May. But at present, most of the misinformation that is about coronavirus is health misinformation, as to have this drug to prevent coronavirus, have that drug to prevent coronavirus. And very often these are home formulations in terms of, have hot water and lemon, have ginger garlic and things like that. Besides that, there's a lot of misinformation about, homeopathy, for example, being used as a prophylactic measure, certain Ayurvedic instrumentations being used for a prophylactic measure, which do not have evidence. And this includes there's a ministry in India called Ayush, which deals with areas of homeopathy and Ayurveda. And they have also suggested certain protocols called Ayush protocols to prevent COVID, but there isn't much research or published work in this area.
So do you see that this is being spread with nefarious intent, all this misinformation, or is it basically people who truly believe they are helping others?
It is not nefarious intent. I wouldn't suggest it is nefarious intent. It is twofold. One, this nationalistic thing about, that there has to be some indigenous solution that has to come about COVID from traditional medicine, the sort of medicines that people have been using for centuries. And there is a solution in traditional medicine, and you don't really have to depend on modern medicine. That is one school of thought where there's misinformation coming from. The other is this insecurity around the pandemic, where there isn't any apparent cure. Yeah, there are a few antivirals that are now in the market, which some of which have been promising, but there is no cure. So it creates a massive insecurity in people in general, and which is why these claims about have this and this is going to prevent COVID, have that and this is going to prevent COVID, those kind of claims get circulated because misinformation is directly linked to your state of insecurity, and that is the other reason why it has been so widespread.
Have you seen any measures, Pratik, to counter these kinds of unverified claims?
So from the point of view of social media platforms, Facebook, Twitter are doing some, Facebook, Twitter, YouTube, but it is nearly not enough. I mean, there's so much misinformation, so many conspiracy theories out there. The other strain of misinformation is, of course, the conspiracy theorists who are out there on YouTube trying to make a buck, putting out videos which are sensationalist in nature, suggesting very random things. Thankfully, in India, there isn't much of anti-vaccine misinformation yet. It is starting to, but there isn't as much as countries like US, etc. experience. But yeah, that is the thing. From the point of view of government, they have a Twitter account now called PIB Fact Check, which is putting out some fact checks, but unfortunately, the fact-checking handle is very biased in terms of what content it puts out, in terms of political allegiance. So people also find it difficult to believe that this is a genuine fact-checking outlet. But there isn't something done at the scale at which it is required, especially in a country as big as India and as populous as India.
Pratik Sinha, thank you very much for that perspective.